Another thing I can't emphasize enough is, if you're diagnosed, educate yourself. I'm afraid that too many people are just jumping to the first thing that comes along. I felt it very important that I find out. I used PCF.org. I used us2.org, which are great information I mentioned before. Another company out there right now that I didn't deal with, but I also follow up, is called bluecure.org. They're on Facebook as well. All three of these are on Facebook as well. But you can't, it's your decision, it's your life, it's your body. And I'm afraid, in my mind, I'm no expert, but in my mind I think too many men are jumping to surgery because they just think, get it out. Well, surgery may not be the option. I'm pleased, like I say now, that I don't have the side effects that might have happened with surgery. So the most important thing I can say is talk with your doctors. Sometimes at most places will recommend getting a second opinion. I was very comfortable with my doctors, so I didn't look for a second opinion. But I educated myself and I asked questions. And your doctors will work with you. They'll work with you, they'll give you information. So when you go into your decision, how you're going to be treated, the most important thing is make an educated decision. I was single, so I didn't have a spouse to deal with, but if you have a spouse, it's a decision you should make together. And I would encourage you to do so.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.